9 warning signs in your feet that could mean diabetes. What your feet may be showing you right now could explain symptoms you've been brushing off for months, maybe even years. And when I reveal warning sign number 1, the one that too many seniors ignore because it doesn't always hurt, you're going to understand why so many people discover diabetes only after serious damage has already begun. I'm Dr. Michael Joel, and today I need you to look at your feet in a completely different way, because your feet are often the first place high blood sugar leaves fingerprints, and those fingerprints can appear long before someone realizes what is really going on. Most people think diabetes announces itself with thirst, frequent urination, or blood test numbers, but that's not always how it begins. Sometimes the earliest visible clues show up much lower, in the skin, nerves, nails, circulation, and structure of the feet. I've spent years seeing older adults come in worried about just dry skin, or just a sore toe, only to discover that their bodies had been signaling trouble for a very long time. By the end of this video, you'll know the 9-foot warning signs that deserve attention, and you'll understand why number 1 is the sign I never want you to delay on. Before we begin, please subscribe to this channel for simple, life-saving health guidance made especially for seniors who want clarity. And stay with me, because warning sign number 9 seems harmless. In fact, many people treat it like a seasonal nuisance, something caused by winter air or aging. But in some seniors, it is the first subtle clue that blood sugar is affecting skin health and nerve function. Let me tell you about Nancy from Columbus, Ohio. Nancy was 69, a retired school librarian, and every January she complained about rough heels. She kept a pumice stone in the bathroom, lotion by the bed, and she assumed the cracking on her feet was just part of getting older. It wasn't that simple. Warning sign number 9 is dry, cracked skin on the feet, especially the heels, the balls of the feet, or the skin around the toes. When it keeps coming back no matter what you do. Here's why this matters. Diabetes can affect the small nerves that help regulate moisture in the skin. When those nerves stop working properly, the skin becomes drier, less flexible, and much easier to split open. And once skin cracks, bacteria and fungus suddenly have an entry point, which turns a cosmetic problem into a medical one. A heel fissure may look minor, but in the wrong setting, it becomes the beginning of infection. Nancy finally came in because one crack on her right heel started bleeding onto her sock, and what shocked her was that it barely hurt. Her fasting glucose was high, her A1C was even higher, and the dry winter heels she had ignored were part of a bigger picture. So if your feet are constantly rough, peeling, or splitting, especially if you're also tired, thirsty, or healing slowly, do not dismiss it. Dry skin alone does not prove diabetes, but stubborn cracking in the feet is one of those small clues that deserves a closer look. And warning sign number 8 hides in plain sight even more convincingly. Warning sign number 8 is recurring fungus, especially athlete's foot between the toes or toenails that turn thick, yellow, brittle, and hard to trim. Let me tell you about Walter from Sarasota, Florida. Walter was 74 and loved wearing loafers without socks around the house. He noticed the skin between his 4th and 5th toes kept turning white, soggy, and itchy. Then, his big toenail became yellow and thick, almost like an old seashell. He tried drugstore creams again and again, but the problem always came back. He thought it was annoying. He did not realize it could be connected to blood sugar. High blood sugar can make fungal infections more likely and harder to clear, especially when circulation is poor and skin barriers are already damaged. Fungus loves warm, moist spaces, and toes provide exactly that environment. But the bigger issue is this. When a senior keeps getting athlete's foot or nail fungus that doesn't respond well, it can be a clue that the body is having trouble fighting off simple problems. Walter's case became more concerning when a crack between the toes deepened. and redness began creeping onto the top of the foot. That was the moment a fungal nuisance became the doorway to something more dangerous. Walter's blood sugar testing showed uncontrolled type 2 diabetes, and once that was addressed, his feet finally started improving. So, if your toenails are getting thicker, darker, more yellow, harder to cut, or if the skin between your toes is constantly itchy, peeling, or breaking down, pay attention. Again, this sign by itself does not confirm diabetes, but when the feet keep losing the battle against minor infections, I want the whole picture checked. And now we come to warning sign number 7, the one many seniors describe with a phrase I hear all the time: "My feet just feel strange." Warning sign number 7 is tingling, pins and needles, crawling sensations, or that asleep foot feeling that happens when you haven't even crossed your legs, and it keeps returning. Let me tell you about Dorothy from Tulsa, Oklahoma. Dorothy was 72, loved quilting, and every night around 9 p.m. she felt a buzzing in her toes. She described it as carbonated water running under the skin, or tiny sparks flickering across the balls of her feet. Because it came and went, she ignored it. She told herself it was age, circulation, maybe sitting too long. But tingling in the feet is often where diabetic nerve trouble begins. When blood sugar runs high over time, it can damage the tiny blood vessels and the nerves they nourish, especially the longest nerves in the body. And the longest ones travel all the way to your feet. That is why foot symptoms so often appear before hand symptoms. Tingling is sometimes the nervous system's early warning signal. The nerve is irritated, inflamed, undernourished, or beginning to malfunction, and it starts sending scrambled messages. Dorothy's labs showed prediabetes that had likely been there for years. Her feet were not being dramatic. They were reporting damage while there was still time to intervene. If you get recurring tingling in your toes or the front of your feet, especially at night or when you're resting, don't just shake it off, and don't automatically blame your mattress, your recliner, or your shoes. Ask whether your blood sugar has been checked recently, because warning sign number 6 is what happens when those irritated nerves stop whispering and start screaming, and this one can wreck sleep, destroy quality of life, and leave seniors exhausted before they even understand the cause. The tragic part is that people often focus on the pain without recognizing what the pain is pointing toward. Warning sign number 6 is burning, stabbing, electric, or shooting pain in the feet, especially if it flares at night when everything else is quiet. Let me tell you about Harold from Mesa, Arizona. Harold was 77 and kept kicking the blankets off at 2 a.m. because he said his feet felt like they were lying on a hot griddle. Some nights it was burning, other nights it was sharp, sudden zaps, like someone snapping a rubber band inside his toes. He stopped sleeping well. He became irritable. He worried something was wrong with his back. But the real problem was not in his mattress or his spine. It was in his nerves. Diabetic nerve pain can be brutal because damaged nerves misfire, sending pain signals even when nothing is actively injuring the foot. And here's what makes this sign so confusing. A person can have burning pain in one part of the foot and less feeling in another part at the same time. So the foot becomes both oversensitive and undersensitive, which is a very dangerous combination. Harold finally sought help when even the touch of a bedsheet started bothering him. His blood sugar was high. His neuropathy symptoms were classic, and his poor sleep had become part of a worsening cycle of stress and inflammation. If your feet burn at night, stab without warning, or feel painfully sensitive to touch, do not tell yourself it's just old age, because age alone does not create that pattern. Pain in the feet has many causes, yes, but diabetes belongs high on the list, especially in adults over 60. And warning sign number 5 may be even more dangerous than pain, because pain at least forces you to notice something. Number 5 does the opposite. It takes away information. It removes the body's alarm system. And once that happens, very small injuries can grow into very big problems before you ever realize they exist. Warning sign number 5 is numbness, reduced sensation, or trouble feeling heat, cold, pain, pressure, or even a pebble inside your shoe. And this is where the risk level changes dramatically. Let me tell you about Louise from Des Moines, Iowa. Louise was 71 and said her feet felt thick, almost as if she were always wearing invisible socks. She could still walk, she could still garden, nothing seemed urgent. Then one afternoon her granddaughter noticed a dark spot on Louise's white sock. And when Louise removed her shoe, there was a blister under the ball of her foot that had already broken open. She had no idea it was there. That is what numbness does. It doesn't merely feel strange. It removes your ability to detect danger. If you cannot feel the early stages of friction, pressure, heat, or injury, you miss the window when a problem is still small. Diabetes-related nerve damage often starts in the toes and spreads gradually upward, and many seniors describe it as walking on cotton, sponges, or cardboard. Louise's loss of sensation turned a simple shoe rub into a wound, and because blood sugar was high, her body was slower to repair the damage. That combination is exactly why diabetic foot problems escalate so quickly once numbness sets in. So test yourself honestly. Can you feel the temperature of bath water on your feet? Can you tell if your shoe seam is rubbing? Do you notice when your sock bunches under your toes, or when you step on something small? If the answer is no, I want you to take that seriously. Because warning sign number 4 is about circulation, and when nerve damage teams up with poor blood flow, the feet become much more vulnerable. At that point, even healthy-looking skin may not be as healthy as it appears. And color changes become messages your body is practically begging you to read. Warning sign number 4 is a change in color, temperature, or hair growth on the feet and lower legs, especially if your feet look unusually pale, dusky, reddish, bluish, or if one foot regularly feels cooler than the other. Let me tell you about James from Knoxville, Tennessee. James was 76, a retired mechanic, and noticed the top of his feet looked shinier than before. Then he realized the hair on his toes had thinned out. After that, his wife said his right foot sometimes looked almost gray compared with the left, especially after he had been sitting in his recliner. He thought it was nothing. It was not nothing. Diabetes doesn't just affect nerves. It can also damage blood vessels and worsen circulation, especially in the legs and feet. When blood flow drops, tissues get less oxygen, less nutrition, and less ability to heal. That can show up as cooler skin, color shifts, shiny skin, thinning hair, and cramps or fatigue when walking. James had peripheral artery disease along with elevated blood sugar, and that combination put him at much higher risk for ulcers that would not heal. So when your feet start looking different, not just feeling different, I want you to stop thinking in cosmetic terms and start thinking medically. And here's what makes number 4 so sneaky. Many seniors assume circulation trouble always causes dramatic pain. Sometimes it doesn't. Sometimes the earliest clues are visual: a foot that is persistently cooler, a toe that looks darker, or skin that suddenly seems thin and glossy can be the quiet beginning of a much bigger problem. And warning sign number 3 is where quiet changes become much harder to ignore. This is the sign that can mean infection, inflammation, or even structural damage. And when it appears suddenly, I do not want you waiting around to see if it settles down. Warning sign number 3 is swelling, redness, and warmth, especially if one foot becomes noticeably hotter, puffier, or redder than the other, even when you don't remember injuring it. Let me tell you about Patricia from Dayton, Ohio. Patricia was 68 and thought she had twisted her foot stepping off a curb outside the grocery store. Her left foot became swollen and warm over the next 2 days. But because she did not feel severe pain, she kept walking on it. That decision nearly changed her life. The swelling wasn't just a sprain. It was a serious diabetic foot complication beginning to unfold under a foot she could not properly feel. In some people, diabetes-related nerve damage can set the stage for dangerous inflammation in the bones and joints of the foot, and in others, swelling with redness and heat can signal infection. The problem is that many seniors use pain as their guide, and pain can be unreliable when nerves are damaged. Patricia's foot was warm enough that her daughter felt the difference immediately when she touched both ankles. That was the clue that sent her to urgent care, where imaging showed damage that required fast treatment and strict protection of the foot. Had she kept walking, collapse and deformity were real possibilities. So please remember this. If one foot is suddenly red, swollen, warmer, or visibly different from the other, do not minimize it. Do not just loosen your shoe and hope for the best. Call your doctor right away, especially if you also have diabetes, pre-diabetes, numbness, or a history of foot issues. Because warning sign number 2 is the moment when a visible wound enters the picture, and from this point forward, time matters even more. A sore on a diabetic foot is not ordinary, and treating it like a normal cut is how people lose precious days. Warning sign number 2 is a blister, corn, callus, ingrown toenail, scrape, or cut that does not begin improving within a few days, or keeps reopening in the same spot. Let me tell you about Raymond from Wichita, Kansas. Raymond was 73 and bought a new pair of walking shoes. They rubbed the side of his big toe and raised a blister. That happens, right? Except Raymond's blister opened, then lingered, then began looking raw around the edges. And a week later, the sock was sticking to it in the morning. He still wasn't worried because it wasn't that big. Size is not the issue. Healing is the issue. With diabetes, even a small wound can become stubborn because nerve damage delays detection and poor blood flow slows repair, while high blood sugar makes it harder for the body to fight infection. A callus can hide bleeding beneath it. An ingrown nail can create a pocket for bacteria. A blister can deepen under pressure from normal walking. Raymond eventually needed wound care not because the injury was dramatic, but because he underestimated how dangerous a non-healing foot wound can become. The question is not, how bad does it look today? The question is, why is my foot not repairing something this simple? If you have a spot on your foot that looks the same day after day, or worse, slowly larger, redder, wetter, or deeper, that is a medical problem until proven otherwise. And now we've reached warning sign number 1. The sign I fear most, the sign that has sent too many seniors to the hospital after they waited too long because it didn't seem urgent. What makes number 1 so dangerous is that people often don't feel it. Sometimes they don't even see it until someone else points it out. And by then, infection may already be far more advanced than they realize. Warning sign number 1 is a sore, ulcer, black area, draining wound, bad smell, or patch of skin that looks dead or dying, especially if it appears with surprisingly little pain. Let me tell you about Beverly from Macon, Georgia. Beverly was 75 and noticed a faint odor when she removed her shoe at night. She assumed it was sweat. 2 days later, her daughter saw a dark open spot under the ball of Beverly's foot, surrounded by thick skin and a little drainage. Beverly said, "It looks awful, but strangely, it doesn't hurt much." That sentence is one of the scariest sentences I hear in medicine. A wound that looks serious but feels mild is exactly what diabetic nerve damage can create, and it is why so many people delay care. Ulcers can form where pressure and friction are repeated, like the bottom of the big toe or the ball of the foot. If infection enters and circulation is poor, tissue can darken, smell foul, drain fluid, and start dying. Beverly needed immediate treatment because the problem was not just on the surface. The danger was what could spread underneath, into deeper tissue, bone, and the bloodstream. That is why number 1 is never a wait-and-watch situation. Let me be absolutely clear here, because this could protect someone watching today. If you see black skin, pus, spreading redness, worsening swelling, a foul smell, fever, or a wound that is getting deeper or not healing, seek urgent medical care, not next month, not after the weekend, not when your regular appointment comes around. Fast care can save tissue, save mobility, and in some cases, save life. And now that you know the 9 warning signs, I want to connect the dots, because none of these signs exists in isolation. They often stack on top of each other in a very predictable pattern. It usually starts quietly, with dry skin, recurring fungus, strange tingling, or nighttime burning. Then the nerves lose accuracy. Sensation fades, circulation weakens, the skin changes, injuries are missed, healing slows, infection enters, and what began as something a person could cover with a sock becomes something that threatens independence. This is why I tell seniors that foot changes are not just foot changes. They are often a mirror of what's happening in the bloodstream, the nerves, and the blood vessels, all at the same time. Your feet are not overreacting. They are often reporting system-wide trouble before the rest of the body catches up. So what should you do starting today, especially if you're over 60 and any of these signs sound familiar? First, look at your feet every single day, including the bottoms, the heels, the spaces between the toes, and the toenails. Use a mirror if you need one. Second, don't walk barefoot, even at home. Because numb feet cannot protect themselves from small injuries. Third, if you have not had your blood sugar checked recently and you're noticing tingling, numbness, recurring fungus, dry cracking, or slow healing, make that appointment. Foot warning signs are not the time for guesswork. Fourth, if you already have diabetes or pre-diabetes, make foot care part of your routine, not something you think about only when a problem shows up. That means properly fitting shoes, careful toenail care, no bathroom surgery on calluses, and no ignoring little wounds. Fifth, get help early. A regular doctor, podiatrist, urgent care clinician, or wound specialist can step in before a problem becomes dangerous, but they cannot rescue what they do not know exists. Delay is what turns manageable foot problems into life-changing ones, and for seniors, losing mobility often begins with one sore that should have been taken seriously sooner. Let me tell you about Frank from Louisville, Kentucky, because his story brings all of this together. Frank was 78. First, his heels got dry, then his toenails thickened. Then he started feeling tingling at night. He ignored all of it. Months later, he noticed one foot looked a little redder and felt warmer. But since it didn't hurt much, he kept wearing the same tight shoes and stayed on his feet. Eventually, a callus under his big toe cracked open. By the time he came in, the wound was infected. What could have been addressed with early testing and early treatment had become a complicated medical problem. The good news, and I want to end on this because fear without action helps no one, is that these warning signs are useful precisely because they can be recognized. Diabetes does not always arrive without clues. Sometimes the clues are on your bathroom floor every morning, standing right there on the mat while you brush your teeth. If you notice them early, act early, and get the right care early. You can prevent enormous suffering. That is the opportunity hidden inside this topic. Not panic. Awareness, not denial. Action. Your feet may be whispering today so they don't have to scream later. If this video helped you, share it with a spouse, a sibling, a friend from church, or anyone over 60 who keeps saying, "It's probably nothing," because that's exactly what many dangerous foot problems sound like in the beginning. And if you noticed one of these signs in yourself while watching, let this be the moment you stop postponing. Get your feet checked. Get your blood sugar checked. Protect your mobility. Because independence in later life depends on the parts of the body we neglect most often. Take care of your feet, and they'll keep carrying you where you still want to go. I'll see you in the next video.